In today's lecture of General Anatomy of Muscles, we will study about the classification of the skeletal muscles according to the group action, the lubricating mechanism provided to the muscles for their movement on the bones, and in the last we will discuss the blood supply of the muscles. So muscles are classified on the basis of group action into four types: the agonist, the antagonist, the synergists, the fixators. Now, in the body there are very few muscles that act alone. Most of the body movements are brought about by the complex interaction of muscles, each playing its own role. Now, according to the group action, the muscles, they are classified into four types, as I have told you: the agonist, the antagonist, the synergists, the fixators. Now, what are agonists? Agonists are also known as prime movers. It is a muscle which is constantly active in the initiation and maintenance of a particular movement. So it is a muscle which initiates and maintains the particular movement, while antagonists are those muscles which produce the opposite of the desired movement. They act to oppose the action of the agonist. Now, when the prime mover initiates a movement, the antagonist also contracts. They help to study the movement by slowly relaxing as the agonist contracts. Thus, the antagonists actively cooperate with the agonists rather than oppose it, but it produces the opposite movement. So the example of the agonists and antagonists are the biceps and triceps muscles present in the arm. The biceps muscle is present in the anterior compartment, while the triceps muscle is present in the posterior compartment of the arm. Now, a muscle producing the desired movement of the muscle, when biceps is required to flex the elbow, here you can see the biceps muscle. When it is required to flex the elbow joint, the biceps contract and the elbow flexes. A muscle producing the opposite of the desired movement, triceps in this example, is acting as an antagonist. So triceps, you can see here, it is lying opposite to the biceps in the opposite compartment, and it contracts to produce the opposite movement. It is relaxing, but it is suitably controlled, but in a suitably controlled manner to assist the prime mover, as I have told you before. So here you can see these are the animations showing the action of the biceps is the flexion of the elbow joint. This is the agonist. This is the prime mover of flexion, while the opposite action is produced by the antagonist here. So now synergists, they are the when an agonist crosses more than one joint. Now, unwanted movement at the proximal joint is prevented by the contraction of synergist muscles, which act as partial antagonists of the prime mover. Now, example can be given by the muscle which produces flexion of the fingers at the interphalangeal, metacarpophalangeal joints. Now, this is done by Flexor Digitorum Superficialis and Flexor Digitorum Profundus. Now, these muscles, they arise in the forearm, from the bones of the forearm, and they crosses the intercarpal joints and the radiocarpal joints, and they are inserted into the phalanges. Now these muscles, they produce the flexion of the fingers. Now the extensors present at the wrist joint, they act as synergists to stabilize the wrist joint so that these muscles can act as flexors of the fingers. So in this animation is shown the flexor digitorum superficialis muscle, and you can see that it is arising from the humerus and the bones of the forearm, that is radius and ulna, and it is going to the it is crossing the elbow joint as well as the wrist joint, then the carpal joints, then the carpometacarpal joints, and the metacarpophalangeal joint and the interphalangeal joint, and then they are inserted into the phalanx. Now here you can see that the action of the fingers, the flexion action of the fingers is being performed smoothly because of the, here you can see that there is no motion occurring here. If these are the weak flexors of the wrist joint also, they produces flexion of the wrist joint also. But when we have to perform flexion at the finger level, the wrist joint it remains in the extension position by the extensors of the wrist joint. They are present in the posterior compartment behind the bones, in the posterior compartment, while this flexor digitorum superficialis muscle is present in the anterior compartment. Now fixators. The fixator in a movement is the muscle or the muscles that stabilizes the origin of the agonist and the joint that the origin spans, moves over, in order to help the agonist function more efficiently. Now, in the best example of the fixators can be given by the rotator cuff muscles. Now, up till now, you know what are the rotator cuff muscles. These are the four muscles which are present in the shoulder region, and these muscles are also known as the guardians of the shoulder joint. Now, they stabilize the shoulder joint in its movement. So now example of the fixators, as I have told you, now in elbow flexion by the biceps brachii, as in the act of curl the bicep or the dumbbell curl. Now in this act, you can see here, this is the flexion of the elbow is occurring, and this is performed by the biceps. It acts to flex the elbow. However, the biceps are attached at two places, proximally as well as distally. Its distal attachment is to the radius and proximal attachment is to the scapula. One of the attachment is to the scapula. And we want to move the radius bone only when we curl a dumbbell or barbell. One of its proximal attachment is to the scapula, as I have told you, and when the biceps contract, the muscle will tend to draw on the radius and the scapula together. The movement of the scapula must not take place. This is accompanied by the fixators by the action of fixators, specifically the rotator cuff muscles, the trapezius, as well as the rhomboid muscles. They work isometrically to make sure that scapula does not move on the torso. So the action of flexion of the elbow can be performed smoothly. Lubricating mechanisms. Now, if the tendon of a muscle is subjected to friction, a lubricating device is always interposed, which may be synovial bursa or the synovial sheath. These devices diminishes friction and allow free movement. Now, synovial bursa is a closed sac of synovial membrane. The delicate walls of the flat sac are separated from each other merely by film of a synovial fluid. In addition to subtendinous positions, synovial bursa are also found in subcutaneous, submuscular and interligamentous ligations. Now here you can see this is the subtendinous bursa, which is known as the subacromial bursa, located in the shoulder region. Now, bursas, there are many bursas in the region of the knee and knee joint. Many bursas are located here, are related to the knee joint. And here the suprapatellar bursa is the subtendinous bursa, while prepatellar bursa is the subcutaneous bursa. The submuscular bursa, here you can see the greater trochanter bursa, which is located beneath the gluteus maximus muscle in the gluteal region of the lower limb. Now, subcutaneous bursa, this is a superficial bursa which are located just below the skin, between the skin and the bone. And example of the superficial bursa include the prepatellar bursa at the knee and the olecranon bursa at the elbow joint. A well-known condition which is known as student's elbow is the inflammation of this olecranon bursa, which is located at the elbow joint beneath the skin and between the bones, and due to repeated friction when the students they study by putting the elbow at the table and continuously pressing them. Due to this repeated friction, this bursa becomes inflamed, and this condition is known as causing pain while performing movements at the elbow joint. So this condition is known as student's elbow. So this is the normal bursa. You can see here normal olecranon bursa, and this is shown here the inflammation of the olecranon bursa known as bursitis. Okay, synovial sheath. Now these are the tubular bursa. These are the form of tubular bursa enveloping tendons. Such sheaths surround tendons when they pass under ligamentous bands or through osteofibrous tunnels. Each synovial sheath consists of two concentric layers of synovial membrane produced by invagination of the tendon into the sheath. The inner layer is called visceral layer, while the outer layer is referred to as parietal layer. The two layers are separated by a film of synovial fluid. The visceral and parietal layers are united longitudinally by synovial fold. This is known as mesotendon, which transmits the blood vessels to the tendon. So here you can see the synovial sheaths encircling the tendons in the fingers. So here you can see how the bursa, it protects the tendons when the movement is occurring. Here you can see this is the subacromial bursa shown here, and beneath lies the tendon, and in contraction you can see that it becomes, this is a fluid filled bag which sac which comes between the bone and the tendon, thus reducing the friction. So blood supply of the muscles. Muscles are supplied by the muscular branches of the neighboring arteries. Now there is a principal artery. Here you can see a principal artery which is entering the muscle, a region which is known as hilum, through which the nerves and the veins also enter or leave, and they are divided further into smaller arteries and arterioles which enter the perimysial septa, and then the capillaries, they enter the endomysial septas and surround the individual muscle cell fiber. So this is all for regarding the general anatomy of the muscles. I hope you have understood it fully. Thank you so much.